back to my video. It's a rainy day outside. I've got my oversized comfort hoodie on and we're gonna study because I have a maternity exam coming up. And at this point, I am near the end of level 3. So the next 2 weeks are gonna consist of a lot of exams. So we're gonna get ready for them. In today's video, I'm going to show how I'm going to utilize ChatGPT in understanding my nursing concepts I need to know for my exam. So we're going to go over a little bit of topics just so that you can see how it flows and how to use this as a study method for your nursing exams. So I'm going to go ahead and put what chapter we're going over, and that is going to be Unit 7. And that's going to be the nursing care of the women with complications during labor and delivery. So let's go ahead and get started. So I'm gonna go ahead and open up my ChatGPT. I typed in, hey ChatGPT, so right now I'm gonna be studying for my maternity Unit 7 exam, and we're going to go over the chapter of nursing care of the woman with complications during labor and delivery. I need help understanding these terms. What does induction and augmentation mean? And why is it so important in terms of labor and delivery? So this is the slide that we're going to go ahead and try to use ChatGPT to better understand. ChatGPT did say that induction of labor refers to the process of stimulating uterine contractions before spontaneous labor begins. So in a nutshell, that basically means that the woman has not started labor yet. She's not in labor yet. So for induction, what induction is going to do is it is going to start labor. So the woman is not in labor yet, so we're going to use induction to start her labor. And this is basically how I use ChatGPT to study. So what I do is I type out whatever concepts I want to better understand. I read the description that it gives me, and then without looking at it, I talk about it out loud. I know it sounds weird, like for instance right now, I'm home alone and I'm talking to myself. But you know what? That's sometimes what is needed in order to have information stick, so you don't forget it. Okay, so now I want to build on my information of induction just so I completely understand how it works and why it is needed. So I'm gonna go ahead and hold in the microphone for me to speak so it types out a question for ChatGPT. Go ahead and hit the dictate option. Here we go. Also, please excuse my dog in the background. Whenever she thinks I'm on the phone, she acts kind of crazy. So right now she's like aggressively tearing apart her toy next to me. So if you hear a weird noise, that's my little angel. Anyway, so let's go ahead and ask a question. Thank you for breaking down induction. So I really want to fully understand how it works. When is induction needed and how exactly do they induce a labor? What methods are used to induce a labor? And tell me information that I need to know in an NCLEX styled way. Break it down so it's easy for me to understand. So this is the information that it just gave me. It gave me the definition of induction, which is deliberate stimulation of uterine contractions before spontaneous labor begins to bring about birth. So again, like I said, the woman's not in labor yet. We're inducing her to start labor. When is induction indicated? Think mother or baby is in danger if the pregnancy continues. So, and there's my angel. Anyway, for the mother, this is if she has gestational hypertension or preeclampsia, if she has diabetes, if she's post-term pregnancy, so if her pregnancy goes beyond the 42-week term, then that is an indication for induction. If she has a uterine infection, that baby needs to come out, so we're going to go ahead and induce the labor. And then we also need to understand, when is induction contraindicated? So this is when we shouldn't do induction. So a huge reason is if the placenta is below the uterus, so especially if it's underneath the baby. This is referred to as placenta previa, and that could warrant a medical C-section, because the baby can't come out of the cervical canal because the placenta is underneath the baby. It's too low in the uterine wall. So another reason why we wouldn't want to do induction is if the position is transverse. So if the baby is laying like this in the uterus, you do not want to induce a labor because the baby cannot come out right. You want the baby to be head down into the canal to be able to come out safely. Also, if we had a prolapsed umbilical cord. So I remember going over this in class. So if for a prolapsed umbilical cord, it could mean that the umbilical cord is wrapped around the baby, and that could possibly lead to the baby being strangled by the umbilical cord. So you don't want to induce a labor. Again, that might warrant an emergency C-section. Also, another reason why you may not want to induce labor is if the mother has an active case of herpes. If her herpesvirus is not active, then you could have a vaginal birth still, as long as they're not active. But if they are active, you do not want that baby coming down that cervical canal because it might be exposed to the lesions of herpes. I also wanted to understand how induction and augmentation works. So it did go over that. So it looks like prostaglandin is a medication that helps speed along labor. So usually it looks like the route is a vaginal insert or a tablet. And then it looks like it went over, this is a really big medication for maternity, and that's oxytocin. So, and it's also called Pitocin. So that can also be used to help speed along labor. And for my slides, so the way I have it set up, I'm gonna show you guys. So I do a split screen. So over here I have my ChatGPT, and over here I have my notes. I really recommend studying this way so that you can see what ChatGPT says and also compare it with your notes from class so that you can make sure you are reading information that pertains to your class. So I'm going on to a new slide in my PowerPoints, and this one is going to be, I'm going to go ahead and put it right here, and I'll kind of move over so you guys can see it better. So this goes over the methods as well. So it looks like the cervix needs to be soft, pliable, and 50% effaced. And at least 2 centimeters dilated. Also, ambulation can help. So unfortunately my phone did die, but whenever you see a medication on your slides, you want to pay close attention to it, because if it doesn't show up on your unit exam, you may see it in your pharmacology exam. So my slides mention cytotec, but ChatGPT brought up prostaglandin. So cytotec and prostaglandin, it's basically the same thing. And then also it went over Pitocin, which is your oxytocin. So again, it's nice to have ChatGPT and this together. I created this slide. So this is basically just screenshots I got off of ChatGPT. So this just goes over where I'm asking why is cytotec important in inducing labor, and it broke it down to say that the purpose of cytotec is to help ripen the cervix. So basically it helps soften and thin the cervix to help start contractions. And it mentioned how prostaglandin is a hormone-like substance that helps the cervix get ready for labor. It also went over how it works. It says once the cervix is soft and thin, the uterus will begin contracting on its own or with additional help from Pitocin. It also went over how it's important to monitor fetal heart rate and watch out for uterine tachycystole, which is too many contractions after giving that medicine. I also like how ChatGPT broke down Pitocin as well, and it basically said that it's used to stimulate contractions once the cervix is ready. Basically, it's to help augment labor if contractions slow down. Similar to prostaglandin, it also mentioned how it's important to monitor your fetal and contraction monitoring and to stop or slow the infusion if contractions become too strong or too frequent. You should also look out for fetal distress and uterine hyperstimulation. I also like how ChatGPT broke it down even more simple. It broke it down to like a couple of words. So for cytotec, just know that it helps prepare the cervix for labor, and Pitocin helps strengthen the contractions to move along labor. I love using ChatGPT because if you look at this, it just makes it look so much more aesthetically pleasing. And for my brain to take in information, I like to look at something that looks good. And it's almost like when I take my exam, I can almost see the chart or the words in my brain as I'm taking the exam. So I really like how it broke it down so that I can look at this and it just looks, I don't know, it looks simple to me. So I like having my notes and ChatGPT, and I like talking everything out loud because it helps connect all of these concepts together. So I hope you enjoyed this video. I hope this method helps you. If it doesn't, no problem. But if it does, let me know in the comments. Also, if you guys want me to go over any pediatric or maternity concepts, please let me know. I am in the end of my level 3, so any help you guys need, just let me know. I have loved my maternity and pediatric level, so if you guys need help, just let me know. Be sure to like and subscribe. See you in the next video.